begin, we're going to have the oral med administration checklist. I brought that with me. I also brought medication information from the CPS, and I've been provided with the medical history form and the MAR and the log for the drug that I'm going to be administering. I also have hand sanitizer, a clock, which tells me it's September 28th, 2024 at 8 p.m. and I have my medications. So to begin, I'll be providing some information about this medication, and I'll just be answering questions. The questions I'm answering would be based on question 1 here, or step 1. From there, I'll go on to describe why it is that this person is taking this medication. So in this case, Kong Lee is taking Lipitor to treat high cholesterol. And now I'm going to create my safe environment. So I'm going to avoid multitasking, have adequate lighting, and minimize distractions. I'll do my hand hygiene. So I'm going to rub my palms together in between my fingers, backs of my hands, both hands, nails on my palms, both hands, and my thumbs, and then I'll continue rubbing for 15 to 30 seconds. Now I know it's 8 p.m. on the 28th, so I'm going to look at the MAR, and the MAR shows that Lipitor is due at 8 p.m. So I'll select Lipitor from the medication storage area. Then I'll begin my checks. So first of all, I'm going to check right person. So on the MAR it says Kong Lee. On the bottle it says Kong Lee. These two names match, so I have the right person. Now I'm going to check that I have the right drug. On the MAR it says atorvastatin calcium Lipitor. On the bottle it says atorvastatin calcium Lipitor. These two drug names match. I know that Kong Lee has an allergy to penicillin, and it's okay to take Lipitor with that allergy. And I also know that there are no contraindications to Kong taking this medication. So I have the right drug. Now I'm going to check dose. For dose, it says on the MAR, take 40 milligrams or 1 tablet. On the bottle, it says take 1 tablet, and these are 40 milligram tablets. This dosage matches, and I also know from the CPS that the safe dosage range for Lipitor is 10 to 80 milligrams per day, and this is being taken once daily, so I have a safe dosage. Now I'm going to check the time. According to the MAR, this medication should be taken once daily, and I can see that it's being taken at 8 p.m. and the most recent dose was the 27th of September 2024. It's now the 28th of September 2024 at 8 p.m. and the bottle also says to take 1 tablet daily. So I have the right time to give this medication. Now I'll check right route. According to the MAR, this medication should be taken by mouth. According to the bottle, it says take 1 tablet daily. I know this is an oral medication. The routes match, and I know that Kong is able to take medications by mouth. Next, I'm going to check that I have the right documentation. So I'm going to look at the MAR first of all. This is a routine MAR because I'm giving a routine medication. It's for September 2024, and it is now September 2024. There's nothing crossed off. I've already written my name at the bottom and initialed. I'm going to check as well that I have the routine log, and this is the routine log for September 2024 for Kong Lee, and there's no entries here. I have the right documentation. I'm going to check right reason. According to the MAR, this medication is being taken for high cholesterol. According to the bottle, it's being taken for high cholesterol. According to Kong's medical history form, he has high cholesterol. And according to the CPS, this drug is used in the treatment of high cholesterol, so I have the right reason. The bottle indicates that this medication expires in May 2025. It's now 2024, so the medication has not expired and it's been stored properly. I'm going to start my second check, and I'm going to begin with right person. So according to the MAR, This medication is for Kong Lee. According to the bottle, this medication is for Kong Lee. I'm going to start my medication label now. I'm writing down Kong Lee. So I have the right person. Now I'm checking the right drug. This is Lipitor, atorvastatin calcium, according to the bottle. And according to the MAR, it's atorvastatin calcium or Lipitor. These two drug names match. Kong Lee has an allergy to penicillin, but it's okay to take Lipitor with a penicillin allergy. And I have checked the CPS and there are no contraindications to Kong taking Lipitor. So I'm going to write the name of this medication on my label. So I'm just writing Lipitor, and I'm going to go on to check right dose. According to the MAR, the dose is 40 milligrams, 1 tablet once daily. According to the bottle, it's 1 tablet, which is 40 milligrams once daily. And according to the CPS, the safe dosage range is 80 to 100 milligrams per day. So this is a safe dose. I'm going to be giving 40 milligrams. I'm now going to pour my medication. I'm taking a medication cup, and I'm going to just pour this from the bottle into the lid, just 1 tablet, putting that into the medication cup, and I'm still keeping my bottle out. Now that I've poured the medication, I need to dot the MAR. I'm administering this medication at 8 p.m., so I'm going to use a red pen, and I'm dotting on September 28th. I'm going to continue now to check right time. According to the MAR, this should be given once daily, and I can see that it's being given at 8 p.m. each day. The most recent dose was given on September 27th, 2024. According to the clock, it's now September 28th, 2024 at 8 p.m. On the 27th, it was given at 8 p.m., so 24 hours have passed, and according to the bottle, it says take 1 tablet daily. So I have the right time to give this medication. Now I'm going to check right route. According to the MAR, this medication should be taken by mouth. The bottle says take 1 tablet, and I know that this is an oral medication. I also know that Kong can take medication by mouth, so I have the right route. Now I'm going to check right documentation. I'm looking at the MAR for September 2024, and it's the routine MAR, and I'm giving a routine medication. And there's nothing crossed out. I've dotted it to indicate that I have poured the medication. I've written my name at the bottom and initialed it. And I've also checked my routine medication log for September 2024 for Kong Lee, and there are no entries there. I have the right documentation. I'm going to continue on to check right reason. For right reason, on the MAR, it says this medication is for high cholesterol. On the bottle, it also says high cholesterol. I know from the medical history form that Kong has high cholesterol, and I know from the CPS that Lipitor is used in the treatment of high cholesterol, so I have the right reason. So now I can return this unused medication to the storage area. I'm going to be going now to Kong's room, so I'll be taking with me my MAR and log. I'll be taking the labeled medication. Take my clock with me as well, and I'm going to leave behind the medical history form. I'll be leaving behind any other notes that I have with me, and I am going to be continuing on. So I'll go to the person's room and I'll knock and I'll say, "Hi, my name is Laura. I'm a registered nurse. I'm here to give you some medication. Is it okay if I come in?"
Yes.
Okay, thanks. Can you state your full name for me, please?
Kong Lee.
Kong Lee. I see on the MAR that this medication that I brought is for Kong Lee, and also it's labeled Kong Lee. Can you tell me your birthday, please?
12th of September, 1970.
12th of September, 1970. That's what I see on the MAR as well. So I know now I have the right person to give this medication to. I have to do some safety checks. As I'm coming into your room, I'm going to be sure to do my hand hygiene. So I'm going to do palms on palms, both between the fingers on the backs of both hands as well. I'm going to wash my nails on palms and my thumbs. And I am going to now I have to ask a few more questions to make sure that I'm giving you the right medication at the right time and so on. So this is going to take a few minutes. Is it okay if we continue on? Is that okay?
Yeah.
Yeah. Okay, thanks. So I know that I'm talking to Kong Lee. I now have to check that I've brought you the right medication. So the medication that I have with me is called atorvastatin calcium, or Lipitor. That's what it says on this document here called the MAR. And it also says Lipitor on the medication label. Do you have any allergies?
I'm allergic to penicillin.
Okay, penicillin, that's what I see here on your MAR as well. And it's safe to take Lipitor when you have a penicillin allergy. And there's no other reasons that I know of that you shouldn't take Lipitor. Okay, so now that I've checked the right drug, I'm going to check right dose. Do you remember how many tablets you usually take of Lipitor? No?
No.
No? Okay. So I brought one with you, and each one tablet has 40 milligrams in it. That's what it shows on my label. And also the MAR says that you should take 40 milligrams or one tablet. So I'm going to be giving you one tablet, and I know that's within a safe range of 10 to 80 milligrams per day. So now that I have the right dose, I'm going to check that this is the right time to give you the medication. When was the last time that you took it?
Last night.
Last night. So last night was the 27th of September, and I see that that's shown here that you took it last night. And the clock now is telling me it's the 28th of September 2024, and it's at 8 p.m. now. So the instructions here say to take this medication daily. So since you've taken it last night, it is now time for you to take this medication again. So I have the right time. Now I'm going to check right route. According to this MAR, it says that you should take this medication by mouth. And I know this tablet is for swallowing. Do you feel okay to swallow a pill whole today?
Yep.
Okay, great. And are you okay to take it with water?
Yep.
Okay, I'm gonna go grab some water, and when I grab the water, I'll take my medication label and medication with me, and I'll go back and I will get some water as I leave Kong's room, and then again as I come in again. I'm gonna do hand hygiene. So to do hand hygiene, I will rub my palms together in between my fingers. I'm going to go on the backs of my hands, both hands, nails on palms, both sides. I'm going to wash my thumbs, and I'm continuing to rub my hands for 15 to 30 seconds, or until it is dry. So, Kong, I have brought you some water.
Mm-hmm.
Before we continue on, I have to check that I have all the right documents. So I brought with me a document that's called the MAR, and it's for September 2024, and it's the routine MAR because I'm giving you a routine medication. I put a dot here to show that I've already put this medication in the cup for you, and my name is at the bottom with my initials. The other document that I brought is called the routine log. It's also for September 2024 for Kong Lee, but nothing is written in here yet. So those are the documents that I need. Now I have to check that I'm giving you this medication for the right reason. So according to the MAR, it says that you're taking this for high cholesterol. Does that seem right to you?
Yeah.
And I know that this medication, Lipitor, is used in the treatment of high cholesterol. So, and you've been diagnosed with high cholesterol, so that's the right reason to give it to you. Now, have you been having any side effects of this medication?
Not that I know of.
No? You've been taking it for quite some time now, so I think that if you were going to have any side effects, you probably would have noticed them by now. It would be things like upset stomach, constipation, diarrhea, vomiting, gas, stomach pain, headache, or rash. Have you noticed any of those things?
No.
No? Okay, do you have any other questions about this medication?
No.
No? Okay, perfect. So then I'm going to give you your medication. So here's your water, here's your medication. I see that you're swallowing it whole. That's great. Now that I've seen you take this medication, I'm going to initial the MAR. And I'll clean up the garbage and take that with me. Kong, it's a good idea for you to stay either sitting up or standing up for the next half hour or so, just because you've taken something by mouth. And I will come back and check on you in about a half an hour. Is that okay?
Yeah.
Do you feel fine so far?
Yeah.
Okay. So I'm going to do my hand hygiene while I'm leaving the room. and I put a whole lot of hand sanitizer on there. So I'm doing front and backs of hands between my fingers, my nails, both sides, my thumbs, and I'll keep cleaning this until it's dry. And then I will go and put my garbage where it belongs, and then in a half an hour I'll come back and I'll knock. Hi Kong, it's Laura. I'm coming to check on you after giving your medication. How are you feeling?
Good.
Good. Do you have any questions at all?
No, I'm good.
Okay, sounds good. All right, then have a good sleep.
Thank you. Good night.
Good night.